Hello, my name is Jueun Kim, and I'm going to do the presentation about the case study 2. Let's start. Margaret is a 32 years old woman who has been diagnosed with generalized anxiety. The triggers were that when she went shopping a year ago, she began to feel anxious, like panicky. But it went away after a few minutes. About 2 weeks later, when she encountered the same circumstances, the symptoms was worse than before. She felt fast heart beating, and she was going to lose her consciousness. Since then, she has to hard effort to go out because she felt already anxious. So if she felt that, she often just stay in. She has this kind of fear and sometimes burst into tears for no reason. So she had to get out of shop although she didn't finish shopping. And a week ago, she was already anxious before she went shopping. At the shop, she began to feel a bit breathless and nauseous, so she held tight onto the trolley. She was so embarrassed because she thought that everyone attention to her and think her stupid. She think of herself as a stupid person. When she thought that, she felt a pain in her chest. She has knowledge about panic attacks, so it helps her during about 10 seconds by self-talk. But since she panicked again, she left the shop. After 10 minutes, she went back in and finished the shopping. She think really proud of herself about that. Especially her self-talk that nobody cares me, they are busy their work, unable to go back in. Margaret's maintenance processes could be explained this way. The first triggers leads to fear and anxious. When the same circumstances are given, her psychological and biological vulnerability to anxiety about that circumstances evoke fear, and somatic symptoms bring about a belief that it's dangerous. Although the first panic attack was unexpected, it became interoceptive conditioning and then she will misinterpretations of her somatic changes. As a result, belief and fear about panic became real, so it appeared in reality. So she avoided that circumstances, and the avoidance maintained through negative reinforcement, and she anxious before going out. From the information, I think Margaret's diagnosis can be explained social anxiety disorder and panic disorder. Her symptoms meet DSM-5 criteria for those two. Margaret has marked fear about one social situations in which she is exposed to being observed, and when she showed anxiety symptoms, she was embarrassed because she thought that it will be negatively evaluated. The social situations provoke fear, and trigger situations are avoided and endured with intense anxiety, so I assume that she is diagnosed with social anxiety disorder. It may be confusing with agoraphobia, but not because she doesn't think it might be difficult to escape or not be available to help. And I guess it is highly likely that parents neglected her at childhood or nurtured inconsistently. For this reason, she has a strong belief that she cannot make a favorable impression to others, and has a negative concept of social self. And a year ago, when the problem first started, certain event was possible to happen. For example, she ended the presentation at work with a lot of tension, but she could not answer people's questions at Q&A time. She thought that people would laugh at themselves and regard her as a stupid person, so she was able to have an excessive standard in social performance and conditioned belief in social assessment. And I assume that she is diagnosed with panic disorder. She has symptoms of labored breathing, heart palpitations, nausea, chest pain, dizziness. At first, her panic attacks is unexpected and uncued, but it will be cued attacks, so the diagnosis is triggered by specific situations as shopping. And she prone to respond excessively in small symptoms due to Margaret's sensitive and emotional temperament, and women are twice as likely as men to have anxiety disorder. If she receives cognitive behavior therapy, there are helpful homework assignments and interventions to her. And rather than individual therapy, I think group psychotherapy may be more helpful to her. In the program of group psychotherapy, the following treatment methods will be used. First, when her thoughts were negative, keep a thought record including frequency, duration, and intensity for a week, and find out such as wrong repeated thoughts, stereotypes related symptoms, and the auto thoughts turn into rational thoughts. Second, through exposure therapy, Margaret go to the supermarket where the last occurrence happened each day. If it is difficult at first, Virtual exposure and imagery exposure can be used. Third, she focused on breathing and positive self-talk whenever she felt anxious. To do this effectively, Margaret read the self-help guide recommended by the therapist. Because Margaret is motivated for therapy and to change, I think her symptoms will be better soon, and she already attempted to encounter her problem of avoidance and broke the pattern, so it was a successful experience to her. Through therapy, her excessive responses to symptoms will be reduced, and she will not be sensitive to the evaluation of others, so her social performance will be more successful. Thank you for listening.